Hi, my name is Val, and I'm going to be acting as the clinician introducing you today to reality orientation therapy. Today we'll be demonstrating group reality orientation therapy, or ROT, which can also be referred to as formal ROT. In this group, we will have 2 patients with dementia. ROT has been historically used for elderly patients with mild to moderate dementia without severe characteristics of aphasia. There is evidence to support the use of structured ROT to delay cognitive decline that can happen as a result of disease progression. We suspect that this treatment could be used for people of any age with memory deficits characteristic of dementia, but the literature focuses on the geriatric population, so that's what we're going to be demonstrating today. All right, so now it's time for us to meet our clients. Our 2 group members today are Sochi, a 76-year-old woman in the early stages of Alzheimer's dementia, and Laura, a 78-year-old woman with mild vascular dementia. Since we are in the business of doing best practiced and evidence-based treatment here, we're going to be talking about what you can kind of constrain as best practice for ROT. So we know that group settings that place a cognitive and social demand on the client is going to be the most optimal form of ROT that you can really put together. There is such a thing as 24-hour ROT, which is basically doing that orienting to place, person, time, everything all the time, just bombarding that patient with that information. And unfortunately, that's actually been shown to have detrimental effects on the patient. Just getting that learning and onslaught information every hour of the day can be kind of demoralizing, and it's been shown to increase client depression and decrease motivation because of the lack of personalization. So if your ROT is insensitive and or not personalized to the individual, it's not going to be as effective. Currently, there is no fully standardized or structured procedure or guidance to really outline how to give ROT. However, there are a lot of general principles out there that you can sort of synthesize and make your own for each of your individual clients. So generalized principles of ROT are that an individual should be oriented to time, location, physical space, and personal information first. The individual should also be reoriented to their own situation and interests. In subsequent sessions, after that baseline orientation has been established, the treatment should stimulate social interactions, and the patient should be encouraged to reestablish social ties. Particularly, the patient should be encouraged to actively participate and voice their own opinions throughout the entire group session. All right, so now that you sort of have a baseline for ROT, let's get started with some demos. For the beginning of treatment, it is generally agreed upon in the literature to focus on the basics of orientation, like where the individuals are, why they're there, what the environment is like, what the date and time is, and who is generally with them. All right. So, hello. I am here with Laura, who is a wonderful lady. She is 78 years old and currently has vascular dementia. So, Laura, today you're here with us at the University of Arizona Clinic to work on sort of keeping track of who you are, why you're here, where you are, and what you're doing and who you're hanging out with. Just things to really help you get oriented and able to enjoy life. All right, and our friend for the group therapy today is Sochi. So Sochi is 76 years old, and she has the beginning stages of Alzheimer's dementia. Sochi, same idea for you. You're here hanging out in group therapy today with Laura so that you can both get a better idea of just keeping track of what's going on and back into that social aspect of being able to enjoy hanging out with a friend. All right. So I kind of introduced you, but I think just so that we can all get off on the right foot, it's important for you both to introduce yourselves to each other. So Sochi, why don't you start? Tell me a little bit about yourself, and then tell me one thing about today that you can tell from either the information on the board or that you just know.
Hi, I'm Sochi. I'm 76 years old. Today we are in February of 2018, and I'm really excited for Valentine's Day next week. It's my husband and I's anniversary.
Oh, that is so sweet, and you've told us such wonderful things about you. So your anniversary is next week, and you're excited for Valentine's Day, and all of that was really wonderful. I just want you to double check something for me. So you told me it's February of 2018. Can you just double check really quickly using this calendar and let me know if you catch anything that might be different?
Oh, it's 2019.
Yes, awesome job. So it's actually February of 2019, but you're right, Valentine's Day is coming up. Okay, very nice. So Miss Laura, can you tell me anything about yourself? Introduce yourself to Sochi.
Hola, my name is Laura.
Hola.
I am 78 and I have 2 kids. It's nothing special is happening next week, but I'm happy to be here. Today the weather was sunny at 60 degrees and we're here at the University of Arizona.
Yeah, wow, I love how much information you gave me and really nice problem solving skills going to the board to find the info that you needed. So yeah, it is Sunday, it's a beautiful sunny Sunday, it's February 3rd, 2019, and we're all here for group therapy. For this next demonstration, we are 3 sessions later. It is now Sunday, February 24th. Okay. So at this point in the treatment, you would be directing attention to topics of general interest, historical events, favorite celebrities, notable social events in their lives, and then you can even start incorporating challenge activities like visual spatial exercises that can be incorporated into what you've already had planned for group. So incorporating those voicing opinions and active participation components into the pre-structured activities that you have for group is going to be one of the most important components at this time. So if your activities are cognitively demanding, that's even a bonus for you because you're going to get the most value out of their time, and that cognitive demand paired with social necessity is going to actually help the treatment to generalize as well. Okay. Ooh, Laura, you get a challenge card. So Laura, can you tell me one fact about Sochi that's not her name or her age?
Your anniversary is this month?
Yeah, that's a good fact. Nice job. Seems like you're learning some really nice things about each other.